Taking air into your lungs is the most vital function of the human body. But what if you were diagnosed with a serious illness that affected your ability to breathe? What would you do? Well, returning to our show to help explain how clinical trials work and why you might want to consider participating in one is Dr. Frieda Lewis-Hall, the Chief Medical Officer of Pfizer. Welcome back.
Hi, thank you. It is great to be back. And it's exciting to be back to talk about something that people don't talk about very often, clinical trials. And here's what I'd really like for people to know. Clinical trials are very well-controlled studies that enroll patients to gather information about new medical treatments. The doctor provides the treatments, carefully monitors, and collects information, whether or not the drug is working, what the side effects are. All of that information is then submitted to the FDA, who will decide whether or not the drug is approved for use and who should use it.
And Dr. Michael Weitz is an emergency room physician who found himself on the other side of the stethoscope when he was diagnosed with advanced lung cancer. Take a look at his story.
Dr. Michael Weitz is used to assessing and taking care of patients. Little did he know he would become one himself, and the diagnosis would be dire. This is a man who never smoked a day in his life. He was always so healthy, and yet here he was dying of stage 4 lung cancer, diagnosed after he had trouble swallowing. In his mid-40s, loving husband and father, and now cancer patient.
The hardest thing that we had to do was when we told our kids. I mean, that was heart-wrenching. I mean, how do you tell your kids that you have lung cancer and you may not be around for very long?
He immediately went through chemotherapy, radiation, had his left lung removed. Still, his chances of survival, less than 15%.
6 to 8 months at best was all I had time to live.
The cancer spread to his bones, his brain, his chest. He was running out of options.
It went from 1 second living this wonderful, blessed life to just this overwhelming feeling of not knowing where to turn, what to do.
Then his mom heard about a clinical trial. Now Dr. Weitz is telling his story so others will not give up.
And I can tell you, it's so good to have you with us today. Tell us about your experience with this clinical trial.
I've been very fortunate because I was a participant in 2 clinical trials. My cancers were significantly diminished after these trials. Now, I don't think I'm ever going to be cured, but I think we can successfully manage my disease.
And Dr. Weitz, your story is the perfect story as to why some people participate in clinical trials. It gave you a chance to be more in control of your health and to help others by contributing to medical research.
And of course, most people don't really understand clinical trials. Tell us about your experience.
You know, the message that I want to send to people is do not fear clinical trials. You must embrace them. Because without clinical trials, nothing happens. There's no new treatments. There's no new cancer treatments or any type of treatment.
And you know, unfortunately, not a lot of people know about clinical trials and even fewer participate. There are nearly 40,000 trials currently underway, but only 1 to 2% of Americans participate in them. So if you take a common disease like diabetes or cardiovascular disease, where you need large numbers of participants in clinical trials, you need lots of people. You need women and men, people of all ages, and people of all ethnic backgrounds.
But of course, I do have to be realistic. With any type of medication, device, or medical trial, there can be unpleasant, serious side effects. The good news is clinical trials are conducted with strict medical oversight. They're regulated by the federal government. There's no guarantee, though, that the treatment will be effective. But clinical trials, as Dr. Weitz said, can be an opportunity to support cutting-edge research for new medical treatments.
And it's important, if people want more information about clinical trials, or if they want to find out if there's an appropriate clinical trial for themselves or a loved one, they should talk to their doctor. Or if they want more information, they can get some really important resources and links on healthierworld.net.
And Dr. Weitz, you keep spreading the message of hope.
Thank you. I will.
So very much. We'll be
I
rooting
will.
for you. Doctor, thank you for joining us once again. And from preserving your health to preserving your food, find out how to make your food last an extra week when we come back.